Weight loss. Weight loss.
Easy weight loss.
Miracle diet drug. Miracle weight loss drug.
Ozempic has been dubbed the new wonder drug for weight loss. Some people have even reported losing up to 20 to 30 pounds in just a few months on this medication. So what's behind all of the success and craze of this drug? And is it all that it's cracked up to be? In this video, we will be discussing facts about Ozempic and some of the downsides of this weight loss drug. Stay tuned. Hi, I'm Dr. Lindsay Marie. I'm a board-certified family medicine physician, and on this channel, I like to discuss wellness in the form of nutrition. I also make educational videos on other health topics, so if that's something you're interested in, be sure to subscribe. Now, let's get into this topic. First of all, I would like to say that Ozempic is the brand name of the once-weekly drug you can take in the form of an injection known as semaglutide. And you can inject this drug into the abdomen or thighs once weekly. It comes in 3 standard dosing options, 0.5 milligrams, 1 milligram, or 2 milligrams. This medication was first approved for adults with type 2 diabetes in 2017. It's used to improve blood sugar levels and reduce the risk of major cardiovascular events such as heart attack, stroke, or death. Now, I just wanted to show you guys on the website where it discusses about weight loss, and so we'll go there now. As you can see, this is the website for Ozempic, and at the top it's showing that it is the once weekly semaglutide injection with the 3 doses there. And this is one of the statements it makes. Ozempic may help you lose some weight. Ozempic is a medication for adults with type 2 diabetes that, along with diet and exercise, may improve blood sugar. While not for weight loss, Ozempic may help you lose some weight. And adults taking Ozempic lost up to 14 pounds. So as you can see on the website, people who were taking Ozempic did lose some weight, but the drug was not originally intended for weight loss until later, and we'll get to more of that in just a minute. So now we need to discuss how the medication works. Ozempic acts as a GLP-1 receptor agonist that selectively binds to and activates the GLP-1 receptor, the target for the native GLP-1. Ozempic lowers fasting and postprandial blood glucose by stimulating insulin secretion in a glucose-dependent manner. And that's a lot of medical jargon, but in more simpler terms, basically Ozempic works by binding to the GLP-1 receptors and stimulates insulin release from your pancreas when your body needs it. The active ingredient in Ozempic, semaglutide, also induces satiety, which is the feeling of being satisfied or full, and therefore it also suppresses your appetite, and that's how it also works for weight loss. About 1/3 of people who took Ozempic reported losing up to 10% of their body weight within the first 1 to 2 months. With all of the evidence of people losing weight on this medication, the FDA decided to approve it in higher doses to treat obesity in 2021 under the brand name Wegovy. And in 2023, the FDA approved it to treat obesity in adolescents ages 12 and up. Since then, talk of this drug has popped up all across the internet, and even Elon Musk has been reported to tweet that he was using Wegovy. On TikTok, the hashtag Ozempic has been viewed over 300 million times, with people expressing their shock over their recent supposed medication weight loss. And it's not just being used in America, many other people in other countries have been using this medication for weight loss as well. As of late 2022, the FDA has listed both Ozempic and Wegovy among other medications in short supply, so much that there has been a worldwide shortage of these medications. And that brings us to the part of the video where I would like to discuss 3 main downsides of Ozempic and this widely used trend for weight loss. Downside number 1, it creates a problem for the patients with diabetes who are now not able to get their medication, potentially putting them at further risk for health complications if their diabetes is left to be uncontrolled. You yourself might be a patient who has diabetes and has been using Ozempic for diabetes control, and this may have affected you. Downside number 2, the medication can come with some serious risks and side effects that people may overlook just because they see the great success of weight loss. So now I just wanted to take you guys back to the websites of both Ozempic and Wegovy just to show you some of the important safety information and list of side effects. So back on the Ozempic website, as you can see here, it's showing important safety information. One of the serious side effects of Ozempic is that it can possibly cause thyroid tumors, including thyroid cancer. So you want to talk to your healthcare provider if you notice any of these signs, such as a lump or swelling in your neck after taking this medication. And then down here we have the main side effects and the more serious side effects, which include inflammation of your pancreas, including pancreatitis, changes in your vision, low blood sugar or hypoglycemia, kidney problems, including kidney failure. And the reason is because people who are on Ozempic tend to have a lot of nausea and vomiting. And this may cause loss of fluids or dehydration, which may cause kidney problems to get worse. You can also have serious allergic reactions to the medication or gallbladder problems. However, the most common side effects of Ozempic may include nausea, vomiting, diarrhea, stomach and abdominal pain, and constipation. So those are the list of side effects for Ozempic. And over here is on the Wegovy website. It's showing the serious side effects as well. There are a lot of the similar ones: pancreatitis, gallbladder problems, increased risk of low blood sugar or hypoglycemia, kidney failure, serious allergic reaction, change in vision in people with type 2 diabetes, increased heart rate is listed on this one. They are also listing depression or thoughts of suicide. And again, the more common side effects, just as was listed for Ozempic, including nausea, diarrhea, vomiting, constipation, stomach and abdominal pain, headache, tiredness, upset stomach, dizziness, feeling bloated, belching, gas, stomach flu, heartburn, and runny nose or sore throat. Whew. So that is a lot of side effects listed on the website right there for your information that a lot of people tend to just overlook when they're so excited about losing weight on this wonder drug. And that's something that I wanted to point out as the importance of looking at safety information prior to starting any medication. I will say from experience of seeing many patients on this medication, the majority of the side effects that have been reported include a very persistent and consistent nausea, and some that do present with vomiting. So how have people been combating this negative side effect from this weight loss medication? Well, they end up asking their doctors for yet another medication known as Zofran to help stop their nausea and vomiting. And let's be honest, that's not always the best medical practice to just add another medication to help with the side effects of the first medication. Plus, who would want to have all of the extra cost and expense and going to the doctor's office multiple times for the medications? And that brings us to the third downside, which is that once you stop the medication for weight loss, you will lose the weight loss effects, as your body no longer has that semaglutide binding to the receptors and producing the release of insulin, and also providing you with the feeling of satiety and appetite suppression. So when you come off of the medication, you could potentially gain all of the weight that you lost right back. With all of that being said, the main message I wanted to get across today is that yes, Ozempic or Wegovy is known as a medication to help treat obesity and provide weight loss with some success. But with any weight loss craze or trend out there, it is best to do your research. Make sure you are fully aware of all of the negative implications of the weight loss trend. Like in this case, people who have diabetes were not able to get their proper treatment, as well as all of the harmful and potentially life-threatening side effects that could occur from taking this medication. As a family medicine doctor who strongly believes in wellness in the form of nutrition and preventative medicine, I think that it is always best to focus on more natural sources of weight loss. Drugs cost money, and trips to the doctor cost you your time. They also come with potentially serious side effects, so why not focus more on natural approaches to weight loss first, at least? I do understand in some cases of obesity, all previous measures have been tried without success of losing weight, so taking medications such as Ozempic and Wegovy may be a good option in those cases as a last resort. Just make sure that you take into consideration all that we just talked about and have a thorough conversation with your doctor regarding the risks and the benefits. As a doctor, I would love to encourage all of you to weigh the risks and the benefits of treatment options for yourself, whether it be for weight loss or any other treatment options that you may be presented with. Make sure you make the best informed decision for you and with the help of your doctor's guidance. And lastly, I just wanted to hear from all of you guys. What are your thoughts on this topic? Have you heard about the downsides of Ozempic before? And if so, what were they? If not, what have you heard about Ozempic? If you happen to be a patient on Ozempic, is it for diabetes or weight loss or both? What has been your experience with either weight loss or side effects that you may have experienced? You can also tell me about the ease or difficulty of getting this medication from your doctor. So be sure to leave a comment in the comment section below and let me know all about it. You can also ask me any other questions that you may have. I would be happy to answer those for you. And as always, thank you for watching. Feel free to like or share this video. Also, don't forget to subscribe as I am making new videos like these in the future. And until next time, bye!